Hi, I'm Dr. Crathan, the Medical Director at Florida Dermatology Specialists. I'm board certified in dermatology and both fellowship trained and board certified in micrographic dermatologic surgery. Let's review some information about your pathology result. You will receive a call from a Florida Dermatology Specialist team member to discuss your results further. Your biopsy showed a Lentigo Maligna, which is a type of melanoma in situ found on sun-damaged skin. It generally requires surgery for treatment. Based on your pathology report, we can treat your Lentigo Maligna in the office. It had no measurable thickness on the biopsy report, which is the best possible prognosis for melanoma. It generally requires an excision or staged excision when found on the head and neck, meaning a margin is taken around the cancer site and down into the fat layer. We will do the surgery with local anesthesia here in the office. A melanoma like this does not require any imaging or scans based on the information we have from the biopsy report. You also do not need a referral to a medical oncologist, but we would be happy to make one should you so desire. The surgery itself is therapeutic and nearly always curative. It's important to have this procedure done soon. In addition, you will need to come for an examination every 3 months for the first year. Let's talk more about what a staged excision is. This procedure is generally performed for Lentigo maligna or melanoma in situ on the head and neck. Patients need to plan for a somewhat flexible schedule for the week. We start these at the beginning of the week in the morning only and continue until wound closure later in the week. For the Palm Beach Gardens office, we only start staged excisions on Mondays. For the Stewart office, we only start staged excisions on Tuesdays. This early melanoma is removed on the first day of the procedure with a small margin. The tissue is specially marked and sent to the pathology lab for rush processing in a very specific manner where the entire peripheral and deep margin are evaluated by the pathologist. The pathologist can also use special tissue stains we do not have available in the office to highlight the cancerous cells. The wound is left open and not closed on this first day. The wound is bandaged and the patient is sent home. The results are usually available from the pathology lab in about 30 to 36 hours. We will communicate them as soon as they are available. If not all of the melanoma has been removed, we will usually see the patient the following day or 2 days later for further removal and then further processing. The wound is again left open. This process is then repeated until the melanoma has been fully removed. It usually takes 1 or 2 sessions to remove it, although sometimes more may be required. Once the skin cancer has been removed, the doctor will review the options for healing. Most commonly, the wound is closed with stitches. Most often, the wound is closed into a line of stitches. Sometimes, some nearby skin may need to be moved to help close the wound, which is called a skin flap. Other times, skin may be moved from a more distant site, which is called a skin graft. We can safely perform all of these in the office. Sometimes we allow the wound to heal on its own. It sometimes takes a long time to heal on its own, but it may be a preferred option for some patients in some select circumstances. Some patients may ask if they need to see a plastic surgeon. My training in Mohs surgery and reconstruction through the American College of Mohs Surgery means I'm qualified to perform your surgery. If you would like, we would be happy to set up a consultation in the office to discuss this further. Activity like vigorous exercise, tennis, or golf may be limited during that time until stitches come out. In addition, there can be no underwater submersion until the stitches have been removed. This means no swimming or baths until then. There will be a pressure bandage on the site, and it can be removed 48 hours after surgery. There is often little required wound care after that. Showering will be fine after the pressure bandage has been removed, which is generally 48 hours after surgery. The risks of the surgery are small, but they include bleeding, low risk of infection, 3% recurrence of the cancer, and a thin scar. We recommend for all stage excision patients to have a driver if the surgery will be performed on the face. There will likely be a bulky bandage on the area that may obstruct or partially obstruct vision for driving. You should also review our video on preoperative concerns and protocols. Please call the office if you have any questions at all regarding your diagnosis.